we have partnered with some of these charitable clinics to go out, put the bus in their parking lot, and work with the primary care physicians to say, we need you to find the people who need dermatology care the most, where there's something that you can't figure out as their primary doctor, and we will follow up.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Dustin Portela. Dr. Dustin Portela is a board-certified dermatologist, skin cancer surgeon, skincare educator, and founder of Treasure Valley Dermatology and Dēne Skincare. Welcome, Dr. Portela. Thank you for joining me.
Thank you, Janelle. I'm excited to be here and have a great conversation.
Yes. So I first saw you on LinkedIn and started following because I saw you have the mobile health initiative. So I was really excited to chat with you about that. But you've got a few other things going on, and you're really popular on social media. So I just wanted to jump in and hear a little bit about your story, how you got into dermatology, and to all of the amazing things that you're doing today.
Yeah, I grew up with a dad who was a science teacher, and so spent hours in his classroom as a biology teacher, chemistry, and anatomy and physiology teacher, just learning about this stuff from very young ages. I was very curious about the things that he was doing in his lab at the high school, and then even once I was in middle school, I started getting out of class, and I would go with his high school class on their field trips when they would go visit doctors' offices. And he had, a lot of passion about helping kids who grew up in this very small farm town in rural Idaho to go out and get into the health professions, because it was a way to, really create a great career for themselves and to help a lot of people. And so I remember field trips going to the, funeral home and learning what an embalmer does and a funeral director, physical therapy offices, doctors' offices, shadowing surgeons. And I started doing this from a young age, visiting the cadaver lab. When I was still in middle school, he would take trips with his class to the university. And at the end of the semester, after the bodies had been dissected, we would get that experience. And so I got interested in healthcare from a very young age. And as I progressed in my education, really was trying to decide whether I'd go to PA school or med school. And that's a whole nother story. But eventually decided that I would go to medical school. And my goal really at that time was to become an emergency physician. And when you shadow in healthcare, there are certain specialties where you don't get to do a lot. And there are certain specialties where you can be a little bit more involved. And when the ER is really busy, even when you're a student shadowing, you can play a little bit more active role to go. And I was there as a patient advocate, so I could get, food and drinks for the patients that could have them, blankets. I could sit and talk with them and sometimes even stand there and very, lightly assist with things. And a few times I was able to follow patients from the emergency room into the operating room when they needed something done urgently. And that fascinated me. When I shadowed in dermatology, which I did only because my roommate had shadowed this derm and said, it's great, you should check it out. I wasn't able to do a lot. Nobody wants to let a student touch them, especially if they're coming in for something cosmetic. But I started to learn first about Mohs surgery, which is a very technical surgical skill that dermatologists have pioneered. And I had no concept that dermatologists did surgery. And I really fell in love with the practical aspect of dermatology, working with your hands. And that's part of what drew me to emergency medicine. And as I did well in med school, did well on my boards, and began to realize dermatology might be an option, I started to move more of my efforts into that realm and was very fortunate in a competitive landscape to be able to get a dermatology spot, and have been very happy with that trajectory in my career, caring for patients of all ages with a wide range of conditions, both medical and surgical.
That's really cool. Sounds like your dad was a fun teacher.
Yeah.
There's so much more hands-on experiences that you've gotten that there was not when I was in high school.
Yeah.
So that's pretty cool. That is amazing. So from that point, did you always know, like, okay, dermatology is where it's at. This is what I want to be?
Yeah. Once I really got a taste of it, I kind of always had in the back of my mind that if I could become a dermatologist, that's where I would like to go. But everybody knows it's so competitive. And I had advisors tell me, unless you have an uncle or a parent in dermatology, don't even try. It's not worth it. And I just didn't buy into that. I really believed that I could put in the work and shape my own destiny. And fortunately, that did work out with plenty of roadblocks along the way, but learning how to overcome them. It was just never something that I feared and didn't back down from. And I know it doesn't work out for everybody that also feels determined, but I'm so grateful that it did for me. And it's allowed me to create the work environment that I love and take care of my family. And I think truly serve patients in a way that feels right to me.
Yeah. So what came first, founding your office or the mobile health initiative? Where did that come about?
Well, when I left residency, I began working for somebody else, and it was just not a great situation for me. It wasn't the kind of practice environment that I felt that I was going to thrive in. And so after being there for about 10 weeks, I told them I was quitting and had about a 4-month transition period where I worked on starting my own office. And that's when I started Treasure Valley Dermatology less than a year after getting out of residency. And we grew quickly. We're in an area where there's a high demand. We added a second office location, eventually a third, and then we've consolidated into a brand new building still to have 2 locations. And I started to grow on social media, and I'd always wanted to do a mobile clinic. Our medical school had a mobile clinic, and I was part of this homeless camp outreach was the name of the club, where on Sundays we could go and we would take coffee and water and batteries and clean socks and just go visit with the homeless population, the unhoused population in Des Moines, Iowa, and starting to learn the stories of these individuals and the challenges that they had in their lives and the situations that they faced that led them to be unhoused was very touching to me. About once a quarter, then the school would use a physician. We would go out in the mobile clinic. That was the first time I got to do a physical exam on a real patient and present that to a doctor. And then they would write prescriptions for these people and work with a pharmacy to get them at no cost. And I just thought it was such an amazing project that the school did and that we could be a part of. Even at that time when I didn't know if I was going to be an emergency doctor or a dermatologist or radiologist or anesthesiologist, I knew that regardless of what I would do, I'd find a way to do charitable care in a mobile clinic. And 2 years ago, I was able to make that dream a reality. And it's been a very rewarding part of my practice.
Yeah. How does it work with the mobile initiative? Do you have a name for?
Yeah, we don't have like a name for the bus. I've tossed around the idea of the Mole-mobile. I thought that would be clever, but it does have the name of the clinic on the side as well as my name. And we primarily go out and do charitable care. I've never charged anybody money to be seen in the mobile clinic. So it's a bad business decision, but it's a very rewarding personal decision. We do a lot of free skin cancer screenings where we'll go out into the community. We have a very generous credit union. Frontier Credit Union has been a partner with us. They helped us get across the finish line to afford this project. And we do these free skin cancer screenings several times a year where we're finding skin cancers hopefully earlier than the person might otherwise have them checked. They're not used to going into a dermatologist. And we've partnered with a lot of the free and charitable clinics in the area because these patients that are being seen at free clinics don't have insurance and they can get primary care and sometimes some dental care done, but it's very difficult for them to get specialty care if they can't afford it. In our area, everybody is private practice in dermatology. There's no hospital employed groups. And so a lot of these clinics are just charging cash for people without insurance. And there's a lot of people that just can't afford that. So we have partnered with some of these charitable clinics to go out, put the bus in their parking lot and work with the primary care physicians to say, we need you to find the people who need dermatology care the most, where there's something that you can't figure out as their primary doctor, and we will prescribe medication for them. We will get that medication to them at no cost to the patient, and we will follow up. And we've had cases where we've diagnosed skin cancer in the mobile clinic, and the patient can't afford to get that done. And we've brought them into our regular clinic and provided that service to them on a case-by-case basis. And so we're continuing to expand the offerings that we have in the mobile clinic. We're starting to reach out to individuals who want to be a part of an educational initiative to share their story where we can go to them and talk about the skin disease that they've lived with their whole life and showcase the tools and resources that dermatologists can have and use to make somebody's life better and change their life and really show a transformation. So more of that kind of content is coming.
Yeah, that's amazing. So I like how you partner with a lot of the primary care physicians, because I feel like there's, a little bit of a disconnect there, and trying to connect dermatologists or specialists with primary care, especially in dermatology when you're looking at skin cancers and things like that. So what happens if you find someone through the mobile clinic that needs Mohs surgery?
Yeah, we have brought them into the clinic and done Mohs surgery for them, and we've eaten that cost. I essentially pay for it because although I have done Mohs surgery in the past, I've much more focused on spending my time doing medical dermatology and then the charitable care. And so I'm essentially paying my Mohs surgeon to take care of those people. So we're just covering the cost of that at this time, and always still looking for community partners that want to help in that. And it's, something I believe strongly in. We can't give somebody a diagnosis of skin cancer and then say, see you later. We've got to follow through on that.
Yeah. Yeah. That's huge. So what kind of education are you providing? I know you've got a huge TikTok social media following. So I feel like you're kind of catching people that are on social media, and then you've got, people that are probably not anywhere involved in social media. So you've got a great balance there. But what kind of education are you providing, and how are you able to get that out to people?
Yeah, the ultimate education that I provide is really still that one-on-one patient interaction. When somebody comes into the clinic or into the mobile clinic, and we're able to tell them that this spot is okay, this spot is not okay, and here's the difference, and here's what you look for, and here's how you do a self-skin exam. And when we provide that education, that person's life is going to be better. It's the same with educating people on doing self-breast exams or testicular exams to catch cancers at a much earlier stage. And we take that same education on social media, and we tell people, hopefully in the thousands, hundreds of thousands, and sometimes to the millions, how to do a self-skin exam, what to look for, when do you know if a mole has gone bad, what's the difference between eczema and psoriasis, how do we treat it, how do you just make your skin healthier by lifestyle as well. So it's very much the same kind of educational strategies. And we've had, thankfully many instances where we can showcase a patient in that with their permission to help tell a story about how hidradenitis, for example, impacts their day-to-day life and why it's one of the most challenging conditions that we treat and the tools that we have. So that hopefully somebody watching online that may not have the right diagnosis yet can see that and say, hey, I think I have that, and I didn't know it could be treated. And I've just been taking antibiotics from urgent care over and over and over again. But now I know that there's things, and they can go and they can ask their doctor about it. And so we hope to have a much larger impact, but it really still comes down to that one-on-one patient interaction.
Yeah, absolutely. What do you think has resonated the most with your audience with just providing this information?
The example that I gave about hidradenitis, I think that's one condition where I get more personal messages from a video than any other condition that I talk about because of the huge impact on quality of life that hidradenitis imposes. It is something where patients get boils and cysts under their arms, in their groin, on their buttocks, sometimes under the breast, that can rupture, that can smell bad, and it causes more depression than anything else that we deal with in skin disease, more than psoriasis, eczema. Well, we also educate people on how to catch skin cancer early, and I've received numerous messages from people that said, I saw your content, I decided to go and get a spot checked, and it turns out it was skin cancer, but we caught it early. Thank you for the education that you share. And that is incredibly meaningful to me because the social media side is fun. You get to be creative, and everybody loves the dopamine rush of a viral video. But when it comes down to it, I want to know that the work that I'm doing is making people's lives better. And we do see that when we educate on skin cancer and hidradenitis, particularly, for example.
Yeah, that is huge. I think a lot of young people are just getting all of their information on social media. So, they're getting those questions like, oh, I need to go ask my doctor about this. Oh, so it's really good that you're able to do that and hitting such a huge audience that really needs to have that education and understanding of what to look for. And so, okay, you have your mobile health
initiative. It's a working name. So, Dēne Skincare, to be transparent with the audience and with my patients as well, is a white label skincare. So these are not formulas that I particularly own. But when we first brought a brand of skincare into the office to sell, I started to be troubled by the fact that my patients could buy the skincare from me, and then when they ran out, they were going online to purchase it. And I had patients bringing in what ended up being counterfeit product. And they would say, I bought this on Amazon and it has a different color. Like, what's wrong with this? And I said, well, it looks like a counterfeit product. You got something that was not legitimate from the company, because a lot of these physician dispensed skincare companies do not sell online, and they're quite vigilant about taking down people that are selling their products online. But there are counterfeit products that pop up and trying to capitalize on the name of the brand. And I was trying to work with the company to become an online reseller for them, and they were not willing to let me do that. They had let some other doctors do it, and I was still, somewhat new on TikTok, but I had a couple 100,000 followers, and I'm like, I really need this for my patients and for my followers, and they were unwilling to let me do that. And I said, well, I'm going to search for a different solution that fits my patients better. And so we partnered with a company to create Dēne Skincare, where we curate the formulas, the things that we want, the things that our patients are asking for, and then also offer them a place where they can purchase the products online. And I'm confident that they're getting the same products that they're purchasing in the office.
Yeah. I see that as a growing problem. I mean, I hear that all the time with just buying products on Amazon. You don't know where it's coming from. The manufacturers are all over the place. So even if it looks like it's legitimate, you don't know if that product is, just sitting in the warehouse and they're grabbing it from the different companies. So yeah, that's a huge thing. So did you find that there was specific things outside of the counterfeit products that there was a need for, that you decided that you wanted to kind of reach that need?
Yeah, it also came down to just the relationship with the company and the fact that I felt like I was being treated differently than some of the other doctors that were selling their products. And, I was a young dermatologist, and a lot of the people that were becoming authorized resellers online had been on their advisory boards. They'd been there a long time. And I felt like, well, you want me to talk about your products online. You're allowing me to help you build your brand to be even bigger, but then I don't get any reward for that. And, obviously it's not all about money, but I think it's fair for anybody to be compensated for the work that they're doing. And although we don't make tons of money on our skincare line, it is something that helps to fund the mobile clinic for me. And so I talk about that in all of my YouTube videos, that when people purchase the products, that money really goes into a fund to help us put gas and pay for insurance and to put equipment in the motorhome that we use to take care of people. And so I wanted to really have something that could help serve my overall mission of the way that I like to take care of people. And so we partnered with a lab that allows us to do that.
Do you think that there's any kind of government funding or support that you're able to get for that initiative? I feel like there's got to be somewhat, because there's so much need for it. I mean, I feel like you could have a bus in every city.
Yeah, there absolutely are grants and things that we could apply for. The biggest challenge that we ran into is when I first started forming the organization for the mobile clinic, is we wanted to do it as a nonprofit. And the process for operating a nonprofit is pretty laborious. It takes a lot of compliance, and I did not want to make a misstep. Obviously, I have a for-profit business with the medical clinic, and what would be a nonprofit and essentially operates as a nonprofit for the mobile clinic. But because of the potential overlap and the fact that if I see somebody in the mobile clinic who is eligible for Medicare and I don't bill them, I'm in violation of my contract in the traditional clinic. And I was just nervous about having difficulties with compliance. And so we ended up forming it as a for-profit company, even though we operate it as a nonprofit. We don't make any money off of the mobile clinic, but it helps me not to get in trouble with the government, with Medicare, CMS, the IRS. And if the time comes when I can fully step away from the traditional medical practice and opt out as a Medicare provider, my ultimate goal would be I'd love to never charge people for the work that I do as a dermatologist and bring that revenue in other ways. And so because we are not technically a nonprofit, according to our organizational framework, there's many grants that we're just not eligible for. And that's probably the biggest challenge that we've had as far as getting funding, is that a lot of the grants are only able to go to nonprofit corporations.
Yeah. Is there anyone else that is doing this? I haven't seen any mobile clinic, and not in dermatology at least.
Yeah. There is an organization called the Sun Bus, and they do free skin cancer screenings. They've partnered with a couple of brands like Castle Biosciences and some of the sunscreen brands. And they travel the country and partner with dermatologists. So the Sun Bus will go to Colorado, and then it'll be in Texas. And they do free skin cancer screenings. But I'm not aware of anybody that's doing it and providing the full spectrum of dermatology care at a nonprofit, business model. There's a mobile company out of Florida, which has received some criticism for the way that they practice, because they're going and doing a lot of procedures in senior living facilities and things, and they're billing Medicare for everything that they do. And while bringing that access to people, I think, is good, you also have to make sure you're not unnecessarily treating people who otherwise don't need it.
Right. Yeah, that makes sense too. So what area do you cover? Is it the whole state of Idaho or just a couple cities?
Yeah, we primarily work in the Boise area. It's not fun to drive a motorhome on a long road trip. It's slow. It's loud. The air conditioning, you're trying to air condition, a 40-foot motorhome. So it's hot. I just did a 4-hour trip with my son because we went back to my hometown and did some skin cancer screenings there. And my son came with me. So we can cover the whole state, and we've been outside of the area 2 or 3 times now. And as we find people who want to, have their individual stories told, we'll go wherever we can. I can take it down into Utah. I do have a medical license in the state of Utah. So we plan to go down there when the opportunity comes up. But it's just a long trip to go somewhere in the mobile clinic. And there's so much work that can be done right here in our backyard.
Yeah.
So, that's, kind of the plan for now, is to keep working through Idaho and then expand into Utah. And then we'll kind of see where we go from there.
Yeah, that is pretty awesome. I love that you're driving the
I'm the only one insured to drive.
You don't have a driver.
No, I don't have a driver.
That's dedication right there for sure.
Yeah.
I love that. I mean, it just goes to show that your heart is there to serve and to support your patients, and you're passionate about this. And that's, it's not something that you see often. So I really commend you for doing what you are doing. I think that it's so amazing to see that and to know that, we know that patients need help. They need a lot of that support. And a lot of people, they just don't get help because they can't afford it. And they're afraid of the cost, and they're afraid that they're going to get a bill and, having to choose their health over getting food or clothes for their kids or, family. It's really sad, but it's really amazing that you have this and that you're able to support so many. So I really appreciate that. That's really cool.
Yeah. Thank you.
So what's ahead? What is the next step? What are some goals and projects on the horizon? I know you said you're looking to expand into Utah, as far as like content creation and things like that. Where else do you go from there?
So we really want to get into individual storytelling. And I hate to make the analogy of like reality TV, because I don't want to do reality TV in the way that makes anybody look bad. But what I really want to do is have full control over the way that we film and edit, so that we can go out and tell individual stories. I had a veteran reach out to me recently who struggles with psoriasis, and we're trying to coordinate with them to take the mobile clinic to them and try to understand how this condition has impacted their life and provide them with the full options for treatment that anybody would get if they were to come into the clinic. And I want to take the mobile clinic to people with any type of skin disease that has not been treated appropriately, or maybe they haven't gotten the right diagnosis, and really film an individual's transformation and show what medicine can do to improve the lives of people. And so that's really where we're going to start focusing as we, continue through this year and into next year, is individual storytelling to showcase what dermatologists can do, that we're not just Botox and pimple popping, but we have a lot more to offer. And really, promote the field of dermatology for the many good people that I know are in it. I have amazing colleagues. So that's really where we want to go with things. Yeah. Well, I'll also be working with a new telehealth startup. I want to be able to offer telehealth to as many states as possible. I can't take the mobile clinic everywhere, but we're working with an organization to help get state licenses in more places and offer telehealth, where they really will be interacting with me when prescriptions are sent in, so that if somebody has come to trust me online, that I can also be the one to provide their dermatological care.
Yeah, that's cool. There's so many dermatology conditions that I feel like people don't even realize is treated with the dermatologist. It's wild.
Yeah.
There's even some that, my 15 years in derm, I'm like, wait, what is that?
Yeah.
I hear a new drug indication that came out and I'm like, wait, I need to look that up again.
Yeah. Yeah. We have some creative names in dermatology, long, complicated diagnoses.
Yeah. So, getting information out there so that people understand it, I think is really impressive. But yeah, I love that idea, especially because they've seen you online. They know, all of your content. They see you a lot. So they trust you. And now they can have an appointment. I think that seals the deal. That makes it a lot easier.
Yeah,
Sure.
absolutely.
And so you also have a podcast.
Yeah.
Right?
Yeah. Yeah. Two of them, actually, because I don't know how to pare down my work at all. But my main podcast is called Skinfluence with Dr. Dustin Portela. And Skinfluence is a look at all things dermatology and health. We're not limiting ourselves just to skincare, but we're talking about your lifestyle and the other things that impact your health. Recently, we had on a dentist to talk about how the oral microbiome and tooth and gum health impact your overall well-being. We plan to have on a financial advisor to talk about how to plan for the future and your healthcare needs. I see so many elderly people on fixed incomes who can't afford their own medical care, and how we can help teach, a new generation how to save up for the things that they're going to need in the future. So we really try to tackle a wide range of subjects. And then for people who are in healthcare, we also have something called Med Creator 101 podcast, where we're trying to educate them on how can they get started on social media. I just think we need more voices out there sharing accurate information. And so we're trying to create those tools to do that.
That's cool. I love that. Okay. So if anybody is in the Boise, Idaho area, how can they get in contact with you or learn about the mobile clinic, where you'll be, that kind of thing? Or do you post all of that on social media too?
Yep. The mobile clinic, all of that information is always shared on my personal Instagram at Dr. Dustin Portela, Dr. Dustin Portela. And we have Treasure Valley Dermatology here. The phone number is 208-SKIN-DOC, or the website dermatologyboise.com if you're interested in becoming a patient. But everything else that I do is posted online on pretty much every social channel at Dr. Dustin Portela.
Okay. That's cool. Well, thank you. We'll also put that in the show notes as well. But this has been such an amazing conversation talking with you and hearing about all of these really cool things that you're doing. It's just nobody's doing it, and I love it. I think it's really amazing.
Awesome. Well, thank you for the kind words. It is a labor of love. So
yeah, I appreciate it. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.